Hi everyone, Assalamualaikum and a very good afternoon. Again, my name is Shi. I'm your moderator for today. Thank you for joining our 30-minute with specialist. And for today, our guest and our speaker is from pediatrician from Avisena Women's and Children's Specialist Hospital. So without further ado, let us welcome Dr. Tan Eng Kian, Consultant Pediatrician from Avisena Women's Children's Specialist Hospital. Hi, Dr. Tan.
Hi,
Hi,
Shi.
how
Hi,
are you?
everyone.
How are you?
Hi, I'm Dr. Tan Eng Kian. I'm the consultant pediatrician for Avicenna Women and Children's Specialist Hospital.
How are you, doctor?
Good.
Good, huh? All right,
Yes,
so we
everyone
have
stay home and stay safe.
okay. So actually, 30 minutes with specialist with Dr. Tan today. So we have we have gathered a question. I mean, like many questions actually. So we just selected a few questions for you to answer. So without further ado, now it's like 3:05. So let us continue. Yeah. So
Yep.
Okay, first question. Can you please introduce yourself and also what is usually a pediatrician does?
Okay, as we know, pediatrician is the doctor specialized for the kids, for the children, for the babies. So normally, when baby born or delivered already, is under the care of pediatrician. So normally, when baby born in hospital, we will make sure baby breathing okay. Then after that, we will make sure baby is there, baby born or the physically or are normal before baby was actually sent home. Then subsequently, we will monitor baby jaundice, baby weight gain, and subsequently, will be whether the breastfeeding at the feeding part, whether is it adequate, whether the weight gain is good. And subsequently, then only we'll go for the vaccination part and also to monitor baby growth and development during the each visit. And when baby is our children unwell, also we are playing a role in to see what are the reasons when babies or children who are unwell and what other treatment can be given to the child.
Okay, sorry, the topic for today, it's importance of childhood vaccination. So can you please explain details? What is the vaccination and what is vaccine consists of?
And no problem. So normally we say, what is vaccine? Nowadays, I would say everyone is talking about vaccine, but vaccination is a method of giving antigen to stimulate the immune response through active immunization. A vaccine is an immunological biological substance designed to produce specific protections against a given disease. Vaccine is antigenic but not pathogenic. Means when a vaccine is given, our body actually will react by create antibody to neutralize the disease, which is not cause the disease itself to the person who received the vaccine. So how vaccines works? A weakened form of a disease antigens that may be dead or living is injected into the body. Then our body actually will react to the antigens by creating antibodies to attack it. If certain antigens ever enters or ever encounter or ever go into our body system, our body immune system will immediately produce the antibody to fight or neutralize the antigen. So it's a sort of protection for us against the disease. So normally we are saying that vaccines can prevent serious child disease such as diphtheria, tetanus, pertussis, measles, mumps, rubella, tuberculosis, influenza, Haemophilus influenza B, pneumococcal infections, hepatitis B, A, polio, chickenpox, and also COVID vaccine in future. So as we can see from the photo, this is a child with polio, this is a child with measles infections, this is the child with diphtheria and also mumps, and from the X-ray, this is for a child with pneumococcal infection and also tuberculosis infection, where you can see there is a cavity inside the lungs, whereby you can see a pus collection there. And for this child, you can see from the left side of the lungs also fill up with all the pus. So these are all the disease that we can actually prevent by giving the vaccine. So normally there are a few sites of the immunizations. The baby at the time, we actually sometimes can give it into the thigh, and subsequently bigger child can give over the delta area and also some gluteal area, which is over the buttock. And what are the contraindications for vaccine? Normally, absolute contraindication for any vaccine will be severe anaphylactic or severe anaphylactic reactions to a previous dose of vaccine or to any component of the vaccine. And postponement during acute febrile illness, a minor infection without fever or systemic is not a contraindications. Normally, we will just postpone to a later date. A relative contraindication will be avoid vaccine within 2 weeks of any elective surgery. What are the conditions which is not contraindications? Means if let's say, oh, the children having such encounter, actually you can still safe to go for the vaccination, like mild illness without fever, like diarrhea, cough, runny nose, asthma, eczema, skin infections, treatment with any antibiotics, or when the child's mother is pregnant and if the child is still having prolonged jaundice, which already determines a breast milk jaundice, underweight or malnourished, or over the recommended age. What do you mean by over the recommended age? Means initially maybe due to some reasons that the child was not vaccinated, and now the parents actually decided to vaccine. So these are the times that we can actually catch back the vaccinations. Family history of convulsion, history of heart disease, or any prematurity also are not a contraindications for the vaccine. Means all of these individuals are still safe to provide the vaccination.
Right. So there's so many like vaccine that you mentioned earlier. So generally, could you just please share with us the latest national immunization schedule, which is Janual Imunisasi Kebangsaan? What are the difference between now and also before?
Okay, as we can see, this is the latest national immunization schedule. Compared to the previous one, last time government used, or Kesihatan used to give hepatitis B. Normally at birth, the time we already given BCG and hepatitis B. And at 1 month old, the time we will give hepatitis B. Subsequently, 2 months old, only we will give the diphtheria, tetanus, pertussis, polio, Haemophilus influenza, and at the 2 months of age. But now government actually also having these combinations of vaccine, which is the hepatitis B no longer given at 1 month. So we combine together given at 2 months, as we can see from the table, 2 months, 3 months, and 5 months for these combinations of vaccine. So no longer separate the two. And another very interesting new vaccine in the national immunization schedule will be the pneumococcal vaccine. Last time, for us pediatricians, we fight for years to actually bring in this pneumococcal vaccine into our national immunization program. So as we can see, finally, pneumococcal vaccines are already included, which is the first dose will be at 4 months, 6 months, and 15 months. This will play a very important milestone or stepstone to our immunization program to fight against this invasive pneumococcal disease.
Yeah, I was like, that is my next question about the pneumococcal vaccination is added to the schedule. So, I mean, in details, could you please let us know why is it included?
Yeah, because for pneumococcal disease, if let's say the child actually acquired the disease itself, sometimes they may have some serious infections into the lungs, into the ears, or even into the brain. As we can see just now from the X-ray that we share, the child actually having a pus collection inside the lungs. Whereby in this group of children, actually we need to insert a chest tube to drain out the pus. This will be a very painful experience for the children or for the patient itself. Besides that, this is the disease that we can prevent. So that's why after outweigh the benefits of the children getting the vaccination, at last our government actually insert this into our national immunization program. And we actually are having like some optional vaccination as well. Other diseases like chickenpox, meningococcal infections, hepatitis A, influenza, and also rotavirus or JE or Japanese encephalitis, those are the optional vaccine, also important to be given to the child. So if let's say those parents who receive their vaccination in the health clinic, they are also sometimes, if let's say the parents are aware of the optional vaccine, they can actually look for their family doctors or any pediatricians nearby to discuss on this optional vaccine as well.
Right. So before we proceed to the next question, I forgot to mention, if any of our viewers who have question for Dr. Tan, please drop your question in our Zoom chat box and also Facebook chat box. Yeah. So before we proceed, let me just say hi to Puan Siti Haja, Puan Adila from our Facebook. Yeah, thank you for viewing our 30 minutes with specialists. Okay. Next question. What is the effect of not having your child vaccinated?
Very good questions. So normally we say waiting can be risky. Why we don't want to wait? Because if you vaccinate early, the child actually can have the early protections, and you will never know when an exposure or outbreak may occur. And once an outbreak has been identified, or when the child is already exposed to the disease, or the child already acquired the disease, the risk of the child actually getting the severe disease is there. So this can be a very risky things. And the decision not to vaccinate is a choice to remain at risk for the disease. Same thing, like you can see the photo here. All these are vaccination. This is the preventable communicable disease. So you are taking out your bullets of protection if let's say you decided not to vaccine. So the purpose of vaccine so that the child can have protection earlier, so that and when they encounter such communicable disease, the time their body already equipped themselves with the, I will say, army for the infections, and to prevent them from getting these severe infections.
All right, so our next question. So now due to the pandemic, right, parents are worried in getting their child vaccinated at the clinic. So can they postpone their child vaccination?
Okay, this is a very question, and a lot of my parents actually, some of them are actually postponed or get my advice of whether they should postpone the vaccination. You need to know for COVID infections, or now this pandemic is not a disease that can go away in a short duration, won't be disappear in a day or two or a month or 2 months. So this is not something that will go off like that. So this is an ongoing process. So in order, because beside the COVID infections, those communicable diseases that can be prevented with vaccine, we also try our best to give the vaccine to the child so that we can have early protection to the children. So I would say, yes, I understand parents are actually very worried about the outbreak, the pandemic now, and they try to avoid. But reassured for us, Avisena Women and Children Specialist Hospital, our 10th floor actually are try to make sure those unhealthy children will be seen by the pediatrician in the emergency department. So this floor actually will be open for those non-communicable diseases or those vaccination, those children come for vaccination. So relatively actually is still safer for the parents to bring. And beside that, as a initiative or from our hospital, we actually introduced a vaccination called, a drive-through vaccine called Easy Vaccine. Whereby, yes, parents nowadays can just, 1 day or 2 days before, just make an arrangement with my nurse or with the hospital on the date of the vaccinations, whereby registration will be done, payment all will be all done online. And the parents just have to drive the child near the hospital compound, whereby a specific time will be given, a specific parking will be given. And the child will go down for us to check the weight, the length, and then the vaccination will be given, and parents can bring the child home without even going into the hospital car park. Without, yes, very convenient, and without even have to go through the hassle of the waiting at the payment counter, waiting at the registration counter.
Car park, open up stroller.
The car park, and there's no waiting time. When it means is, when I give you, when our hospital provide you the time, okay, your vaccination time is between 3 to 3:15. Make sure you'll be around during that time. When you reach that time, by that time, the slot will be your slot.
Yes, yeah.
It won't be necessarily for you, like if let's say you are in the clinic, it will be like a long queue while like waiting outside for your turn to get the vaccination. So it's a very actually supportive steps from our hospital to the parents as well at this pandemic.
Yeah, it is actually for those parents that are very scared actually to come to the hospital, right? And then
yes, definitely,
because of the rentas negeri lagi kan. And then okay, so just let everyone knows that whoever have question, please drop your question for Dr. Tan in our comment below. And also we do have one question in our Zoom, ya, Dr. Tan.
Yeah.
Okay, anak saya sihat dan kuat. Mengapa dia perlu diberi imunisasi?
Yes, I understand. A lot of parents say, okay, my child is still very healthy, and why we still need to expose them to the vaccine? Because you don't know when they will acquire the infections, when they will get themselves exposed to these infections, and when the outbreak will occur. So we actually prepare ourselves, prepare our children to fight against disease when they encounter the infections. Yes, definitely a lot of parents also will say, why don't we let our children actually acquire the disease to get the immunization, to get the immunity. This is a risk to take because we are not sure which encounter to the disease or when is the time that the child can get a severe disease. So the purpose of us to giving the vaccine even to a healthy children is still to protect, to equip ourselves with the ability to fight against the disease when we encounter or during the outbreak. And with this is very actually important for the child to get vaccinated. And why is that? Because as we know, vaccine is strongly related to the communicable disease. And we want to protect our baby actually right from the start, as mentioned here. And this can actually save our life, save our children's life, and they are safe. They protect our loved one and they are required actually. And disease risk outweigh the vaccine risk. Because we know vaccine do have certain side effects. Why we say that? Because every time, sometimes the children receive the vaccine, we will tell their parents, yes, after the vaccination, please check the temperature, evening time, night time, to make sure whether there is any fever or not. Sometimes the child may have fever. Sometimes the child may have soreness over the site of injection, but these are mild, and compared to the infection risk, these are more important. And we also do encounter very rare cases whereby vaccine can cause severe side effects like severe allergic reactions. So this is the time that we will try to avoid for the subsequent. If let's say we really encounter such a severe disease, but because this is a very rare conditions, the benefit of getting the vaccine compared to these rare conditions, we still, as I say, the disease risk outweigh the vaccine risk. That's why we will still encourage the population, encourage the children get vaccinated.
Okay, you already answered my next question. Adakah vaksin mempunyai kesan sampingan? So you already answered yours.
Okay.
So do you have any additional to add to the question? Adakah vaksin mempunyai kesan sampingan?
I think yes.
All right. So we received one question. If my child missed his vaccination, what should I do?
Yes, if your child missed the vaccination, normally we will see what is the child age, and then from there we will catch up accordingly. So I would say go to your family doctors, or you can actually come to us. We can be happily arrange the subsequent vaccination.
All right. Next question is very interesting question. Can the vaccine cause autism?
Yes, this is a question that a lot of parents actually ask. But we can say is vaccination is safe and won't cause autism because there's no relations between vaccine and also the autism. Because a lot of times actually rise up regarding the MMR vaccine and also the autism. In 1980 to 94, actually, they using that time, we can see from the graph, the MMR vaccine actually is still continue to give to the children between 34 months and 70 months in US. So, and there's the apparent rise in autism during that time doesn't correlate with more children are vaccinated with MMR. This is one thing that we can explain. It's not related to the MMR vaccine itself. We can see only during that time, maybe the awareness about the autism disease is getting more. But that's why more children are actually diagnosed with the disease. And there's also studies. This is the Lancet published a paper by Dr. Andrew Wakefield, a dramatic study that found a connection between autism and vaccine. Why? Because the study, when they do the study at that time, when they did the study at that time, is not based on statistics. There's no control group. It relied only on people's memories and made a vague conclusion that whereas statistics vary. So from all the things that we gather, we actually say vaccine is still safe and won't cause autism. And recently, there are also certain like autism relations to the like genetically also. So there are other parts of the diagnosis for autism. Definitely, it's not because of vaccine causing the autism. So still safe to give the vaccine.
All right. So there is no research. I mean, there is no result saying that vaccine can cause autism, right? So okay. So just to remind you guys, if you have any question, please drop in your question in our comments below, and also from our Zoom platform. Please drop your question in our chat box. Yeah. So we have one question from our Facebook. What is the best vaccine for child during pandemic COVID? As we know, kids are not allowed to take vaccine COVID-19 yet.
COVID vaccine, we are waiting. Now, Pfizer vaccine actually already approved for 12 years and above. Slowly, we will open up to see how early the COVID vaccine can be given. So the usual compulsory vaccine are essential, so means are compulsory. So those vaccines need to be given. Besides that, I will actually specifically advise like influenza vaccine. Influenza vaccine is a vaccine to prevent the flu, the seasonal flu, the H1N1 infections, or influenza A, influenza B. Those vaccines are also important during this period of time to reduce the infections rate, and so that the child can have less chances of getting high fever with flu and cough. Hopefully also may reduce the severity. So I would say, beside all the compulsory vaccine, I will actually, during this particular pandemic, I actually advise all the parents, including adults, to get their influenza.
Oh, adult also can get influenza vaccine.
Yes, definitely.
All right.
Adults, very good. Only one dose needed for 1 year. For yearly, it's a yearly vaccination.
Oh, okay.
Vaccine.
It's a yearly,
for children, the first dose before 9 years old is 2 doses. After 9 years of age will be same like adults, only 1 dose required per year.
Oh, so got 2 doses for kids below 9.
Yes, so when you bring your child for influenza vaccine, that time get yourself registered and receive the vaccine together. So every year, you can actually receive the vaccine together.
Together, eh?
Yeah.
All right. So, okay. Again, if you have any question, please, we have only 5 minutes left with Dr. Tan. Okay, got one question. Influenza vaccine needs to take every year twice. Okay, I think Puan Alia, if we already answered your question, Dr. Kai, influenza vaccine need to take every year twice. So below 9 years old.
Not every year twice, means the first vaccination that time will be 1 month apart. Then the subsequent year, only 1 dose required for the children. Same like adult. Just the initial, the first vaccination they're given to the child will be 2 doses with 1 month apart before 9 years old.
All right, Puan Alia, I hope
only 1 dose will be needed.
All right. Okay. So okay. Any more question? We got 5 minutes left. Okay. Wait. Okay, 5 minutes left. 5 minutes. Okay, doctor. Maybe your advice or your tips to new parents, ataupun not new parents lah. I mean for parents to have your child vaccinated. What is your
my advice at the moment? I think nowadays, like we know like with the advancement of the technology, the accessibility for the parents, a lot of actually articles or a lot of actually teaching whether true or not true from the internet, from the Facebook, from the peer group, or a lot of information actually the parents can gather. But the most important thing is still try to make sure the information you get whether it's true or not. Try to discuss the information with your family doctor or with your pediatrician before you make any decision not to vaccinate your child. Because I did encounter some parents that refuse to the vaccine at the beginning itself. So there are a lot of reasons given to me. I always try my best to explain to them, to show them all these infectious diseases that can be prevented through the vaccination. Some of them I managed to actually pull them back to the vaccination site. Some of them I still need time. Hopefully in future, the follow-up, I can try to persuade them again one by one. Hopefully they can read more, they can do more research.
Yeah.
Because I did encounter some parents say, because my friend said so. I said, how can you justify yourself not to give your child vaccination based on what friend said? It's not based on evidence-based.
In the WhatsApp group saying that, saying this, saying that. In the WhatsApp group saying this, saying that, you know?
Yes. Because nowadays in our medical era, we say everything must be evidence-based. Evidence-based medicine means we must provide you the proof that what is the essential thing of giving the vaccine. And now, during the pandemic of COVID, please, those who are not yet vaccinated for the COVID vaccine, please just go and register and get yourself vaccinated. I know some of them who are already registered for long, still waiting and still say, how come still not my turn yet for the vaccination? But be assured, our government is doing good and the right track, so that the vaccination will be given to you. But those who are not registered, especially now the second phase, 60 years above, please go back and help your parents to check their MySejahtera, check their food, so that they are vaccinated. If let's say no MySejahtera, can register online as well. I did it for my parents, and my parents actually eager to get the vaccine. They even waiting, just take their time to hopefully can get a waiting list, and finally they before the government actually ask them to get the vaccine themselves, give a date to them. So as a responsible for all of us, so that we can actually fastly achieve the herd immunity.
Yeah, right. Thank you so much, Doctor. There goes our 30 minutes, just a short one with Dr. Tan. So
okay, thank you very much.
Yeah, if we have any more question that kita tak sempat nak jawab, nanti we can ask Dr. Tan directly, and maybe we can PM you on our Facebook. Yeah, thank you so much, Dr. Tan.
Okay, thank you. Thank you for the invitation. Okay, stay safe. Stay at home.
Bye.
Okay,
Alright, thank you everyone for watching. So there goes our topic with 30 minutes with specialist, our Dr. Tan Eng Kian, the importance of childhood vaccination. Please get your child vaccinated, okay? So just to recap, we have our easy vaccine. Wait, I'll show you our easy vaccine. Ta-da! So no more reason to delay your child's immunization day. Vaccination is now one drive away, okay? So you can just call us and make an appointment. So we have our dedicated team to cater to you, okay? So again, my name is Shi. Thank you so much. Thank you for watching us, 30 minutes with specialists. Inshallah, after this, we have like many tons of session with other doctors as well. So thank you everyone. Stay safe and take care. Bye guys.